Hello, 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 everyone. Welcome to another episode of Sree's Global COVID-19 Show. My name is Sree Sreenivasan. It's my honor to convene this conversation around various aspects of the crisis. Today is a very special episode, 283, Fighting the Virus and the Lies. We're joined tonight by Aisha Sultan, who is at Aisha S., and she's a syndicated columnist at the St. Louis Post-Dispatch, and you will see her work all over. We encourage you to follow her online at Aisha S. We'll also be joined by Dr. Faisal Khan, who's director of the St. Louis County Department of Public Health. He had written last week about some of the pushback he got on the work he's doing around vaccines, masks, and more. We're going to give you a chance to learn about what's happening in the St. Louis area, but also learn about what we can do as a country to continue to fight the virus. Hi, everyone. I'm Sree. Thank you so much for being here. I'm very grateful to all of you. I'm the Marshall Loeb Visiting Professor of Digital Innovation at the Stony Brook School of Journalism and the co-founder of Digimentors, a social, digital, and virtual events consulting company. Our firm does events like this for other folks. We make talk shows for people, webinars, summits, conferences, as well as doing all kinds of social and digital consulting. If this is your first time watching the show, in the first 275 episodes, we've had more than 1.5 million viewers, 525 guests, 303 of them have been women. Yes, we counted. It's from 75 cities and 22 countries, including the chief scientist of the World Health Organization. You can see our archives at youtube.com/Sreenet. We're in partnership with Scroll Global and Scroll.in. I couldn't do the show without our awesome producers, Rose Horowitz at Rose Horowitz 31 and Vandana Menon, Vandana_Menon. They'll both be live tweeting, and we hope you will share this show with friends and family. They can watch us live or later. We're on Facebook, Twitter, YouTube, and LinkedIn. So right now, if you share this show, people can watch us live or watch us later. And tag a friend, someone who cares about accurate information like we've been sharing from the very first episode, 283 episodes ago. Now, are you ready to meet our guests? They'll be joining us in just a second. Once again, they are Aisha Sultan and Dr. Faisal Khan. They are going to talk to us about how St. Louis County is fighting the pandemic, but also fighting the infodemic, or the problems around information and disinformation about the pandemic. So let me start by welcoming both of them to the show. Hi, folks.
Hi, Sree.
Thank you very much for being here. I know you've both had a full day of work, and here we are at 9 p.m. Eastern time doing the show, 8 p.m. where you are. Thank you for being with us. My first question always is to ask each of you to tell us how you and your family have handled the pandemic, and then we'll talk a lot more about what's been going on. So let's start with you, Aisha.
Well, I've written and talked extensively about how my husband had COVID earlier last year and was hospitalized for a while. He's a healthcare worker who worked at a hospital throughout the pandemic. And he was on oxygen, supplemental oxygen after he got home for 5 months. I also got COVID at the time. And fortunately, my case was not as severe, but it's a very personal issue, vaccination and preventing additional death and suffering and illness in the communities that we live in the country. I have 2 school-age children who missed a considerable amount of in-person learning. And so I'm deeply invested as a parent, as a journalist, in getting correct information out there, and as a columnist with a very strong viewpoint that we should be supporting public health efforts to bring this pandemic to an end as soon as possible.
Well, I couldn't agree more. Let's show folks a little bit about your work and the kind of things that you've been writing about. This is your website. So tell us what it means to be a syndicated columnist. You're one of the few South Asian writers who've had this kind of perch at a major publication in the United States, and we're very proud of what you've been able to do, Aisha.
Thank you. And, I appreciate your mentorship from the very beginning. We've known each other for a very long time. So I like to write about how the decisions that are made in our state, in our country, affect day-to-day ordinary people, our families, and our lives. And so during this pandemic in particular, I've been trying to write from the perspective of parents and people who might not know where to get reliable information or who to believe, and the frustrations and fears and anxieties that people have, and really how terrifying it is. And I've also written quite a bit. I've been a vocal critic about the failures of the state. And I feel like, failures at our national level that could have prevented the extent of suffering that we've seen in this country. And the last thing I want to see is another lockdown, to see greater number of deaths and hospitalizations. As you know, in Missouri, we've made the national news because we are one of the places where the Delta variant has surged, and we have had increasing hospitalizations. And I will definitely ask Dr. Khan to talk more about that. And we do have a significant number of people who are resisting getting the vaccine. So that's something that I want to talk about. How do we break through, and how do we prevent this from becoming an even greater catastrophe and tragedy than it's already been?
Thank you so much, Aisha. Let's go to Dr. Khan. Let's ask him about his life this past year and how your family has been dealing with the pandemic, separate from your work.
You know, it's been an interesting 18 months in the United States. As Aisha put it, we've seen a steady erosion in the level of public discourse at the highest level. What became arguably the worst public health emergency to strike the world in 100 years was heavily politicized in the United States by a previous federal administration. And so the ripple effects of that are still being felt. And some of the issues we're dealing with stem from that. My family, like so many others, has had to hunker down, change our lifestyle, stop going out and meeting people, get vaccinated as soon as the vaccine was available, and continue to take precautions. I can't even begin to fathom the kind of stress that Aisha and her family have gone through, and so many others in our community across the St. Louis region. 2,300 people are dead in St. Louis alone because of COVID, and about 10,000 across the state of Missouri. And we do not want to see a single man, woman, or child end up in the hospital anymore.
Those numbers are quite surprising, and in a way not surprising, because of we know how people have dealt with the information and the pandemic. Let's talk a little bit about a milestone reached today. The president announced that 70% of Americans have gotten at least one dose. And this was a deadline that was supposed to have been achieved by July 4th. Here we are, August 2nd. And what does that milestone mean for us, Dr. Khan? And where do we go from here?
So it's a mixed bag. On the one hand, the 70% first dose initiation completion piece is very flattering. But that has to be taken in context. And, by the way, an awesome job. I mean, it took a superhuman effort and lots of money and resources to even get there. If you had asked me about that 3 months ago, I would have said, no, there's no way in Hades that we are ever going to get close to that. However, 30% of the population is still unvaccinated. Furthermore, that 30% of the population is concentrated heavily in certain parts of our country. And Aisha can talk about this much more intelligently than I can, because she studies this from a social perspective that we don't often get to see within the public health realm. What that means is that if you look at a heat map of the United States, you can see the East Coast and the West Coast and the Northeast and Northwest and California and certain parts of the upper Midwest extreme, the north central part really, well covered when it comes to vaccine. And then there are huge swaths in the middle: Missouri, Alabama, Louisiana, Mississippi, Georgia, Florida, and parts of Texas that are simply not catching up. And so the virus finds a susceptible population. It is a ripe crop for it to run through, and it thrives in it and spawns what I fear will be more variants. God forbid. The most horrifying scenario to come out of this will be a variant that is resistant to all vaccines. That will be a true game changer.
And very scary. Please tell us about why you have been pushing for masks and vaccines and the intersection of those two issues.
Absolutely. People are frustrated. We get it, right? Everybody's been caught up in this battle for 18 months through no fault of theirs. They've had to put their lives on hold. They've had to worry about their jobs, about their children, about daycare issues, etc., and on and on. When they ask us, well, wait a minute, public health, you told us back in November that as soon as the vaccine arrives, we should get vaccinated and we'll be fine. And then came March and April, and you said, now it's okay. If you're vaccinated fully, you can hang out with other vaccinated people without masks. And now come July, you're telling us, no, even if you're vaccinated, you need to wear a mask indoors. That's not because we don't know what's going on or we're not sure about the vaccine or whether the vaccine works. Think about it this way. The battle we're fighting is against an enemy, the virus, that is almost like a shape-shifting, rapidly changing mutant that has the ability to deploy new weapons on the battlefield against you. And so unless we are nimble enough and willing enough to change our own strategy and tactics in dealing with a new threat, we're going to lose. And that's what you're seeing happening. As scientific data accumulates and we learn more about the virus and its variants, we make modifications to our recommendations. The vaccines were the first coat of armor that we were asking everybody to wear. Guess what? The enemy is a vicious one. It came up with a variant that has the potential to penetrate that coat of armor on most occasions. So we're asking people to wear a mask indoors as an extra coat of protection on top of that. That's all that this is about.
Dr. Khan, what was the tipping point data-wise that brought this recommendation about?
So, to be honest, things had been building up over several months. There were case reports coming in from all over the country about breakthrough infections, about situations where people who were fully vaccinated but present in settings where community transmission was so high that they were being repeatedly exposed to the virus every single day. Think about healthcare workers, think about food servers, etc. What happened recently, about a month ago, was that the CDC investigated a cluster of infections, about 370 odd, in Barnstable County, Massachusetts, where Provincetown is. And what they found was very alarming. Essentially, the amount of virus that exists and sits in the nasal passages of unvaccinated people is the same amount that was found in the nasal passages of vaccinated people. So vaccinated people were walking around shedding the virus through their breath whenever they sneezed or coughed, and the virus was jumping from person to person with alarming efficiency and causing disease even in vaccinated individuals. In fact, as Dr. Walensky, the CDC director, characterized it, think about the efficiency with which chickenpox is transmitted within a group of people or a group of kids. That's what we're seeing now. So the CDC moved with haste to say, everybody, even if you're vaccinated, please wear a mask in public indoor settings.
So, and Missouri's vaccination rate, Sree, is nowhere near the national. We're closer to 40%. I think in St. Louis County, we're higher than that. Do you know what the latest numbers are, Dr. Hall?
Yes, we're up to 45.6% at the
And
moment.
the city of St. Louis, which is separate from
Right.
St. Louis County, is a little lower.
Right, it's about 43.7%. There isn't much of a difference.
So we have significant ground to cover yet to get even to that 70%. Dr. Khan, I know there was a lot of controversy at the last county council meeting, and you talked about the way in which you were treated, abusively once you left the meeting, and now there's an investigation into that. I understand that's probably going to be litigated and talked about for some time. I want to know, and I think this is a legitimate and fair question, is when you have the background of all this politics, then how do you move the conversation forward on getting people to comply with what the public health department wants and with getting more people vaccinated? Because that, to me, is the most pressing, urgent issue to save people's lives. Where do we go from here?
Absolutely. So let me answer that in two parts. First, what happened last Tuesday was absolutely shameful and regrettable. The sanctity of the legislative chamber should never be violated in the manner that it was. Order and decorum are the very basis for an orderly discussion. As a public official, and I speak for so many others across the country and in St. Louis, we are called upon to make ourselves available to the legislative body to share information about policy options and decisions and explain our rationale all the time. What happened on Tuesday was regrettable in the sense that a politicized public health issue was used to stoke the worst fears of people, to get them riled up in the form of a rally before the meeting, and then have them brought to the chamber, to the point that when I was asked to come forward and answer questions about the council's concerns regarding the mask mandate, tempers were already beginning to boil over, and it just went downhill from there. What was lost in that moment was the opportunity for the council to receive information, consider their decision options, and then make an informed decision. That was the saddest part about this. And the second piece of this is simply the fact that the virus really does not care what someone's political affiliations are. So, 7 days, almost 7 days have passed since the last county council meeting. Case counts continue to rise sharply across the St. Louis region. In fact, I'm quarantining at home right now on the advice of the City of St. Louis Health Department, because guess what? There was a positive case identified the very next day from the crowd in that room, most of whom were unmasked, most of whom didn't take any precautions related to social distancing, some of whom had children in their laps. So I remember walking into that chamber, looking around and thinking, I'm looking at a super spreader event unfolding. So, I'm despondent at several levels, but this is a sad reflection on where we are at the moment.
But how do we go forward? Because there are people who are completely questioning your credibility. I mean, people who are saying, oh, he's just making this all up and none of this really happened. And, so how do we go forward to regain the trust of people that we need to get vaccinated?
Blaming the victim and trying to impugn someone's character or assassinate their credibility in public through charades, really, they're not investigations, is a time-honored American tradition. That's some of what you're seeing play out. Oh, well, we didn't see anybody shove or push him. What does he think assault counts as? From my perspective, do I have to be sucker punched in the teeth before I say assault? Or is somebody brushing against me and saying something vile count as assault? So, that nonsense is about as American pie, really. And it is a shameful reflection on where we are in this country right now. As for how we go forward from here, our emphasis, you just reminded us that 45%, hardly.
Sorry about that. I was just trying to show this video. Before you finish your thought, let's just play this video, explain what we're seeing here. So many of us were so horrified to see this video. So what is that exactly?
That's the crowd, I think, cheering the moment the council formally voted down the imposition of the mask mandate that I had recommended. But as you can see, and quite a few people in the crowd had left by then, having said their piece or screamed their piece. The meeting lasted 4 hours. So it was a long night. But what you see there is a sea of unmasked people cramped together in a small room and basically free to share the virus. Somewhere along those cheering crowds, there are plenty of Vyrians cheering as well. But, back to Aisha's point, how do we go forward from here? The acrimony and the stupidity and the willful ignorance has to stop. 45% of St. Louis is vaccinated, 55% is not. That's not a good place to be in. And our efforts as public health have pivoted to the grassroots level. We're working with churches, barbershops, beauty salons, daycare centers, school systems, community organizations, neighborhood associations to grab people wherever we can and try to convince them to get vaccinated. And we're finding the entire spectrum of vaccine hesitancy, vaccine resistance, as well as what I would call vaccine hostility, which is very firmly rooted. So it's going to be a long haul, and the progress will be incremental. It may already be too late for us to avoid the damage that will be caused by the Delta variant of this virus.
Dr. Khan, what are you hearing in the ICUs and from the hospitals? Can you share some of the stories that you're hearing from doctors that are on the ground right now?
Yes, I received a text from a colleague who works in a critical care unit where they have ECMO beds, ECMO, which is really, think of it as life support beds. They have 25 ECMO beds, not a single one to spare, and they have a waiting list. They're getting calls from all outlying smaller hospitals wanting to transfer patients. I spoke with another colleague who works—
And that's in the St. Louis area. That's in the St. Louis.
Yes, right here in town. And so ICU capacity is now increasing rapidly. Another hospital just notified us that their ICU capacity is at 100%. They're having to call back people from PTO and that are out on vacation to say, I'm sorry, we need you to cover these shifts. This thing will only get worse before it even begins to get better, and I have no idea when. That's what I meant in terms of time is not on our side. We may already be losing this battle. And what upsets me most about the delay and the confusion created by the council's action last week is that political theater was allowed to take precedence over what should have been a carefully considered decision in favor of the best interests of the people of St. Louis County.
Well, Dr. Khan, I will say, as someone who, whose family masked and obviously, suffered in our own way, thankfully, not to the point of somebody that we love dying, but made sacrifices and got vaccines as soon as we could. I was angry when I heard that we were going to have to put masks on. And I was even angrier at the thought of my children having to wear masks, especially those in high school, because there are certain activities that, I'm sorry, but there is a cost to kids having to wear masks in schools, and we should acknowledge that. There is a cost to it. There is a sacrifice involved. And we can't deny that. But here's the thing. I've seen firsthand the ravages of this virus, and I'm scared to death of a variant coming up that, like you said, I feel like we're in a race against time. If a variant is allowed to develop that penetrates the vaccine and makes people really, really sick at a greater level, then we're really screwed. That's what I feel like that public health officials and doctors, and that's the message they're trying to get out. And I feel like there's been a shift in this state and in our region in the past few weeks to a month that most people who are not working in hospitals are not aware of. They don't know that children are on ventilators and that healthy young adults and the number of unvaccinated people who are filling up ICUs. A lot of people are just not aware of what's really happening there. So I appreciate you sharing that. I do think it's unfortunate that the background of all this ugliness is going to overshadow what should be a rational, scientific-based conversation. There are still people who say masks don't work. And how do you respond to that?
Can I just say that we saw the sign that said masks don't work? The sign said that. It was also not a very diverse crowd. Maybe the diversity was anti-vaxxers, anti-maskers were some of the diversity there, but that says something about the state of this conversation today. So let's talk about that particular question that Aisha asked, and then we'll look at some comments that have come in from our viewers. So what do you say about folks who say that masks don't work?
First, there is overwhelming scientific evidence to suggest that. And I will give you one very simple example. In the United States, every year in any regular influenza season, which begins around the 1st of October and lasts up to the 30th of April, around 36,000 people end up dead of the regular flu, which is vaccine preventable. Okay. Now keep that statistic in mind. In a really bad season where you have a variant of the influenza virus that wasn't covered in the vaccine, it might go higher. But around 36,000 people generally die. And that includes men, women, and children. In the 2020 to 2021 influenza season, that number was in the single digits. I'll give you another example. In 2019, in the 2019 through 2020 influenza season, 1,915 children died of influenza. Guess how many died in the 2020 to 2021 season? 1. What was the difference? People weren't wearing masks in 2019 and 20 with the same frequency that everybody was in 2020 through 2021. Masks save lives. There is no question, no doubt about it. Yes, masks need to be worn. Yes, public health advice needs to be listened to. But at this point in time, those of us who have been in the trenches against this thing for 18 months plus, and those of us who have suffered, like Aisha and family and so many others, have to say that the pandemic of stupidity and willful ignorance has to be a greater danger than the virus itself. And it has to stop, and we have to push back. I would challenge anybody that opposes my views or, showed up at the meeting last Tuesday and thinks I'm full of baloney. Don't believe me. Fine. Go and ask an ER physician or an ICU physician or a pulmonologist or any nurse that works in those settings about what is going on in the hospitals and whether the threat from COVID is real and whether you need to protect yourself immediately by getting vaccinated and wearing masks indoors. I guarantee you the answer will be the same one that I tried to provide to the council.
Oh, Sree, we can't hear you.
I just look at some of the comments that have been coming in, and here is Neil has explained the numbers that you had given, and he says, "Oh my God," and Aparna says 100%. Dr. Khan. Shaheen Pasha is watching in Pennsylvania, says, "Our family's back to masking. As a mother, I'm terrified of our youngest child who is still not able to be vaccinated as he is to go back to school in a couple of weeks." Aparna calls it deadly political theater, as you called it. She likes that comment. And we have a comment here from Rehan who says, "Thank you, Sree, for having these two South Asian heroes, mentors on your show. Sree so rocks." That's great. And here is Ashok Sharma is watching from Kerala in India. And we also have my mom is watching in Kerala as well. So hi, Amma, love you. I should tell this audience, because I have not, that both my parents last month got COVID. They're fully vaccinated in Kerala, got COVID. We're in the same hospital room in Kerala, but they're home. They got something that's locally called the Trump cocktail, very expensive, very not easily available medicine, but now much more easily available. And they are now home. They're doing well. And so I'm so grateful to the doctors, the frontline workers, everyone who saved their lives and kept them safe. So thank you. Let's see who else is watching. Aparna's watching from LA, and Paula's watching from Tallahassee, Florida. Apollo's watching from Montclair. Pradnya's watching from Seattle, Washington. Jonathan's watching from the East Village. He's watched every episode of the show, 283 episodes. I'm going to ask Aisha first for her favorite memory of New York and the East Village. And when are you coming back, Aisha, to visit us?
Oh, I can't wait to come back. I miss New York City so much. It is just, I miss the people. I miss the people the most. The intellectual and creative energy in New York City is just incredible, and I miss it so much. And I can't wait to be back to visit you and all my other friends there. And I will say that there is good news in America. More people are getting vaccinated in this surge. And I like to, because I'm someone who really needs to hear good news to stay buoyant in these difficult times. And so I try to share good news as much as possible. So we are seeing more people get vaccinated as they're seeing this surge and this deadliness happen. And so there are plenty of people who understand that now that children are getting affected, that, at a greater level than they ever were, that they need to do what they can to protect their families. So I think we're in for a rough few months in St. Louis, but I'm really hopeful that we're going to come through this and kids will be able to stay in school and not that many more people will have to suffer. And thank you both for getting correct information out there. I really do appreciate what you guys are trying to do.
Chris says on LinkedIn, and reminder, we're on all these different channels, says hello, but he also says, didn't Fauci lie about masks? And let me just clarify what I saw Dr. Fauci do at the beginning of the crisis in March. I was actually traveling. I was at the airport wondering if I should buy a mask. And I remember on CNN, Dr. Fauci saying, if you wear a mask, you'll futz with it and you might end up causing more trouble than not. So don't wear a mask. And that was what we knew then about masking, right? So Dr. Faisal, can you just explain that and why it's important for us to go with the science as it changes? It is not something that's frozen in time.
Absolutely. You've just said it. So science is not the truth. It is the path of seeking the truth. It's a method to seek the truth. When science learns something new, it changes its findings. That's what science is. It is in constant flux. It keeps up with the threat being presented to it. When Dr. Fauci, and by the way, this remark has been, blown out of proportion understandably by right-wing media, etc., to become its own self-perpetuating myth. No, Dr. Fauci did not lie. No, Dr. Fauci was trying to make a point at the time based on what we knew then. If you remember back in March, it was all the rage about Lysol the heck out of every surface around you, right? Well, we knew by November, based on studies throughout the year, that this virus does not survive well on surfaces or fomites, as we call them, bedding and so forth. So you don't need to scrub everything down with Lysol and bleach, please. And that is a constantly changing situation. There were all kinds of insinuations and conspiracy theories concocted about, well, Fauci said this and Fauci didn't believe it. No, that was not the case. Dr. Fauci is 80 years old. He has spent the last, 60 years of his life in the fight against so many pandemics. It is, you can't even begin to count it. People like me committed our lives to public health as opposed to lucrative careers in clinical medicine, precisely because of people like him, people with unimpeachable integrity and character. So I look to him, as do millions of others, for inspiration every day. Please do not buy into the BS about Dr. Fauci lying about it.
Can you tell us, Dr. Khan, a little bit about your background? You had a chance to work in the private sector and you left it to come here. You also studied in Pakistan. Talk a little bit about that, please.
Absolutely. So I was born and raised in Pakistan. I went to med school there. And then after working in clinics for a couple of years, I stumbled upon a seroepidemiology laboratory looking at viral hepatitis at the place that I was working in. And that sparked my interest in public health as a career. And I realized that there was more to life than just, putting up your shingle and seeing patients all day. That was just treating one person's symptoms at a time. You really are not changing their trajectory in life or health status indicators for an entire neighborhood. And so I committed myself, knowing fully well that, you don't go into it for the money. My colleagues, even my parents at the time, I thought I was crazy. So I went to Australia, I did a master's in public health, and I got some experience in infectious disease epidemiology, found a job in Vietnam, and then moved around wherever life was taking me, Botswana, South Africa, Zimbabwe for a little bit, and then back to Pakistan to work on polio eradication. I've been in the United States for 22 years now. I've worked in 3 different states. on a variety of public health issues, including the last 10 years in the state of Missouri. Most recently, I switched to the private sector over the last 3 years, as Aisha knows, and I had to leave town to do it, which was a hardship for my family. It was a very lucrative thing to do financially. But, you know, somebody asked me earlier this morning on St. Louis Public Radio why I decided to come back to St. Louis. And I said, you know, this is the battle that I've prepared for my whole life. And I'm not about to be caught out 500 miles away from the site of battle. I'm going to dive right in and join my colleagues and do this, right? Because I am a St. Louisan. This is my community. So I gave up a lucrative financial package to dive right back in. Those of us who work in public health are, you could say, nerds, nut jobs in many ways. We don't care about money. We never do it for the money. We treat this as a calling in life, almost a sacred thing in life. And there is no one who can persuade us to give it up.
And Sree, I will say that the latest data that I've seen on racial and ethnic racial breakdown of vaccines in America, the highest percentages among Asians in America. I think 65% have gotten the vaccine, as opposed to compared to African Americans, Hispanics, and whites.
And I guess that's not surprising, knowing that, you know, the emphasis given on trying to trust science, and vaccine programs back in Asia have been the reason that Asia has done as much development as it has gone through in countries like India, China, etc. I just want to show you something. Umar Lee is watching. Says present situation, baseball, and listening to Sree interview Aisha S. and Faisal Khan discuss the current situation in St. Louis County. So he is at a baseball game. I was just trying to see here. He says he's watching the Texas Rangers LA Angels baseball game inside the stadium, and we can, if you could have zoomed in, you would see we're on his phone there. So that's pretty cool. And why not? So folks, please tag a friend or share this conversation. They can watch it live or later. And we just have a few more minutes with our guests. Please ask any questions you have. We'd love to have Dr. Khan and Aisha answer them. We know there's so many things that everybody wants to know. Apollo, who's watching from New Jersey, has a comment and question. How are we even going to reach 30% with millions being evicted due to the Supreme Court's refusal to extend the rent moratorium, and federal outlays for making landlords whole isn't being spent? So this is a more macro question, about also asking about where we are financially and economically.
No, that is a very good question. I was chatting with a friend earlier about, you know, what happens when people end up in situations, and families with kids and elderly parents, etc., being evicted. This really is a very, very difficult spot. I wish the Supreme Court had acted differently, but there are, as I understand it, business pressures that they're responding to. This puts a lot of pressure on state and particularly local entities, municipal entities, because we already have a pretty bad homelessness situation or unhoused situation across the metro area. And we're no different to any other metro area across the United States. We're worried sick about their health. Housing is a form of healthcare as far as we're concerned. And we don't have the resources or the wherewithal necessary to take care of people who are in transition in a transition phase with their housing status. This is going to be another major headache for us to deal with, and I'm fearful about how people will end up in vulnerable situations in the midst of this.
Thank you. And Aisha, please feel free to jump in if you have a question. We have one here from Rahan, who is talking about the biggest challenge is getting kids vaccinated, especially, I believe, in the fall, Dr. Khan, that they're likely to approve the next band of ages that will be allowed to get vaccinated. He asks, as an advocate, what is the best way to educate parents who are hesitant?
I will defer to Aisha to answer that question first, and then I'll comment on it at the end.
I think that definitely parents should ask their pediatrician. this is someone who's cared for your child, has your child's best interest. Ask them, did you get your child vaccinated? Ask the doctors that you know if they've gotten their children vaccinated. And then think about how you might feel if, God forbid, your child does get sick and you had an opportunity to prevent that from happening. I mean, all of us get our kids lots of required vaccinations before they go to school. And I think as soon as this one gets the full FDA clearance and is no longer under emergency authorization, you will see more school districts make this as part of the list of required vaccines. So that would be my answer.
Can I just ask you, Aisha, you've seen also the battle against misinformation around autism and the vaccines that are accused of causing autism. So what are the parallels you see there, apart from leadership or bad leadership from people like Robert F. Kennedy Jr. and Jenny McCarthy and people like that?
Well, sure. I think you're more of an expert in this because you've seen how social media can amplify a great deal of misinformation. We've seen studies that have come out and shown that there are certain key actors and sites that have been responsible for sowing a lot of mistrust and doubt. And, you do wonder, how did it get to a point where a sizable percentage in our country were more willing to trust a stranger on YouTube or somebody on a Facebook post that they don't know, as opposed to their own doctors and their own communities and scientists who spent years studying this? I do think that if you know someone in your family who is susceptible to misinformation on Facebook, then it's really important to be able to hear that. I have one person who I know who is not vaccinated, who has a lot of fears, and I'm trying to do my best to hear that and also sort of respond with, sort of logical information and some of the data. Like, one thing that I'm hearing is, well, if even vaccinated people are going to the hospital, then why should I even bother getting vaccinated? And so then you can point out and say, but the numbers of people that are dying are vastly those who are getting really, really sick. Are the vast majority are those who are unvaccinated. And you don't want to get to that point. So I think like that, having some compassion. I've seen a real erosion in empathy because there's so much anger in our country towards people who are not vaccinated. And I do think we have to pull back on that. And I will always say that we have to try to approach people with compassion, even when we feel like you're ruining this for the rest of us. Please. And that's the only way to be able to address it.
Just today, the CDC announced that 99.9% have not, of people who've been vaccinated, 99.9% have not had a breakthrough case resulting in hospitalization or death. 99.9%. That is,
right.
I mean, what more proof do you need? People say, what about 100%? And of course, nothing in life is 100%. Let's go to some more comments. Subbalakshmi is watching in Bangalore, India, and says, what Dr. Khan says is so insightful and inspiring. I wish folks understand how serious this is. Thank you so much for this very meaningful session. Thank you, Subbalakshmi. And we have a question here from Paramjeet, who's watching from Raleigh, and says, greetings. Is there a long-time effect on children 2 years and up who have to wear masks for upwards of 7 hours?
That's a great question.
Clinically and medically, no. It is inconvenient. It is, getting a 2-year-old to focus on anything is difficult enough. Not pick their nose is difficult enough, let alone, keep a mask on and remain socially distanced, etc. However, there is no medical effect or physiological effect of mask wearing for 5 or 6 hours. Cardiothoracic surgeons, neurosurgeons, ICU nurses, ICU docs and staff wear masks for 24, 36 hours straight at every shift. And they are some of the most smartest people in the world.
Okay, let's keep going. Neil Parekh watching from Springfield, Virginia, and a member of our Digimentors team says, my wife and I can't wait until the vaccine is available for our 8-year-old daughter. We'll get it as soon as we can. It absolutely should be required. Subbalakshmi says, here in India, our kids are yet to be vaccinated. We're still waiting. And there you have folks moving around unvaccinated. This sure hurts at a very deep level. And Paramjeet, thanks you for your answer, Doc. And Bala, I'm going to correct what you've written here. Humans around the world are subjected to vaccination programs and forced to vaccinate. Human trials are not safe. Why? That is not true. What are you talking about? More than 1 billion people have taken this vaccine. You just heard that number of 99.9%. I think also, Doc, people are confused by this item that Aisha mentioned, which is that we're still under emergency authorization. So it sounds like it's not ready, but there is a history of having used emergency authorization in the past. This is not the first time this has happened. Talk about that a little bit.
Absolutely. So those of you who remember the in the United States or elsewhere, the H1N1 pandemic, influenza pandemic back in 2008 and 9, will remember that a special vaccine had to be formulated and distributed to counter that. The emergency use authorization process, by the way, the EUA as it's called, is no different in the intensity and thoroughness with which it looks at data than the regular approval process. The regular approval process just has multiple steps at several intervals to try and gather more data about certain aspects of the product being looked at. So any product that undergoes EUA authorization, particularly a vaccine, is perfectly safe. It has been thoroughly researched, thoroughly tested. The data is perfectly safe and corroborated. It is beyond a doubt as to whether or not it is perfectly usable in human beings.
Thank you. Aisha, tell us, you've done so much writing about families and children dealing with this. When you see these stories, kind of these heartbreaking stories of people now in ICUs kind of having deathbed conversions to, saying, I wish I'd taken the vaccine, saying goodbye to their kids, all of this on social media, it's playing out in media in real time. As a parent, as somebody who's been through, you're dealing with the bouts of COVID yourself. Tell me how you feel and how are you conveying this to readers?
That's an excellent question. First of all, it's absolutely heartbreaking and enraging. I think the three overwhelming emotions I've felt during this pandemic was rage, heartbreak, and anxiety. And I think probably a lot of people can relate to that. And to imagine that there were children who are vulnerable because they are not yet medically eligible to get the vaccine, who are now on ECMO, who are on ventilators, is so heartbreaking and upsetting to me. And my heart goes out to those parents. And actually, I would urge anyone who knows someone who's been affected to encourage them to talk publicly about it. I know that it's hard to do. I understand that. But until we have real people willing to share their stories with journalists on social media, and really, I mean, you could save somebody's life. My husband's an extremely private person, and he was like, yes, tell everyone about what we went through, because even if it convinces one person to take this seriously, then it's worth it. And I, of course, am always willing and open to talk to anyone who has had a late conversion because of an experience to taking the vaccine, because the more that we can amplify those voices and tell those people's stories, it could influence one other person. Heck, I was advocating for our state paying people big bucks to get the vaccine. I know that was a controversial idea, which has not been implemented, but I was totally for that. I'm totally for the former guy, who I'm a huge critic of, taking all the credit that he wants for it. Call it the Trump vaccine. If it encourages more Trump supporters to get it, I'm all for it, because the name of the game is saving our lives and preserving our health and preventing more disrupted education and preventing businesses from collapsing. Like, I think we can all agree that that's everyone's goal.
Right. And also we worry about the next pandemic. I think we've done so badly with this pandemic generally, and obviously we're now making a headway, but we weren't ready, Doc. And now you see, like Manav saying, at this rate, if there are any new pandemics every few decades, our future is at major risk. I don't think it's going to be every few decades. Right. Even you just mentioned, we had one 2008, and then we had, after that, we had more pandemics, and then we had the Ebola scare, and now we have this. It seems like 5 years rather than even decades.
Well, I'll tell you this. In the 10 years that I've been working here in St. Louis, just over 10, we've dealt with H1N1, SARS, Zika, Ebola, West Nile, chikungunya, and now the current pandemic. So the age of the pandemic is here. This will be a recurring event. I hope against hope, we don't have to worry about this every 5 or 6 years. But the globalization piece of this, the hyper interconnected world that we live in, a new variant of the virus, by the way, it's already here. It's called Lambda, and it's in South America right now, wreaking havoc in Peru. It jumps on a flight from Lima to New York in less than 7 hours, and then again across the country to cause havoc. So let us gear up and be prepared for it. And just quickly back to Aisha's point about children, here is the worrying part for public health. Throughout 2020, as we were forced to switch to online schooling and kids were forced to stay away, etc., we've ended up now with a bolus of kids across the United States and in many parts of the world that have not caught up on all their routine immunizations, things like pertussis, measles, mumps, rubella, etc. And so we are desperate to get all those kids vaccinated and caught up just before the fall semester begins in a couple of weeks. And quite frankly, progress on that is slow. I hope parents take that seriously. And as Aisha said, when full authorization comes through, school boards and districts will have the ability to make it part and parcel of that requirement. But we are apprehensive about what the future might hold.
I just want to point out this comment from Manav. Mental health problems are at an all-time high. Therapy is not affordable or accessible. I know that Aisha would have some comments on that as well.
I could not agree more. And there was a concurrent pandemic, a mental health crisis, especially the adolescents and young people were the hardest hit by that. We have yet to see what the long-term effects will be. And I have also advocated that a lot of this money that's coming in, the federal funds, needs to be directed towards mental health services and trying to heal a year and a half of trauma that many kids have experienced. It's not just like, oh, we're back in schools, we're all better. It's not that easy.
We're almost out of time, but a couple of quick thoughts that I wanted to share. One is that I think that's the first time I've heard about the Lambda. Is it a variant or the next? If is it its own virus?
It's a variant. You remember I gave the example of a shape-shifting mutant that keeps learning, observing you, and coming up with new weapons. Well, it's happened. It spawned a new variant, and it won't be the last.
Yeah, well, that's really worrisome, but we hope we've learned our lessons as we go forward. I'm going to come back to both our guests to give us one final thought, each of them. And before that, I want to just remind everyone that we have another show coming up this week. We're very excited that we will be able to have one of our monthly episodes with our friends at In Diaspora. And this is a book launch called Kamala Harris and the Rise of Indian Americans. The editor is Tarun Basu, and several of the authors who have participated in the book will be with us, including Aziz Hanifa, journalist and former editor of India Abroad, who is a great documentarian of the lives of Indian Americans. He himself is Sri Lankan American, but is one of the leading South Asian journalists. So there's not just about Indian Americans, but about the rise of South Asians. And we'll be talking to some great guests this coming Thursday at 9 p.m. So hope all of you will join us. And now I'm going to go back to our guests and ask each of them to give us a final thought. So we'll first go to Dr. Faisal and then to Aisha. So Dr. Khan, over to you.
To all my brothers and sisters in India, we wish you the very best. We have watched with growing dismay and utter consternation the havoc that the Delta variant of the coronavirus has caused in India and other parts of Asia. We're dealing with it now, but you have withstood the worst of it. Please stay strong. God bless you. As far as everybody else is concerned, in the United States, please get over yourselves. Don't be a spoiled brat about it. Don't be ignorant about it. If you're willing to eat a sausage or a frankfurter without questioning what goes into it, stop questioning the vaccine. Get vaccinated. Wear a mask in all indoor settings until we're out of this, or we're going to be dealing with this for a long, long time.
Wow, That's a clear and direct comparison for all these people who carry their cell phones around and don't worry about that. People who eat anything that goes into a sausage. So that Dr. Khan, thank you for that. My mother in Kerala says, in Kerala, not even the elderly have not gotten the vaccine, all of them, and let alone younger people. And Parna says, I wish we had some baseline lessons collectively. Jonathan, who's watched 283 episodes, says one of the most important shows in the series. Thank you. And I do want to ask Dr. Khan before you go, why is it that Pakistan has had a relatively a better outcome with the pandemic compared to other South Asian countries?
So I don't believe that. I don't believe the official statistics. The fact is that the true death toll in Pakistan has yet to be tabulated. As you've heard recently, a recent estimate of the true death toll in India put it at 4.5 million, whereas the official was 440,000. So the same is true for Pakistan. And so take it with a grain of salt. Pakistan is suffering just as much, and the vaccination effort is on desperately. It really warms my heart to see people desperate to get the vaccine, lining up for hours to get the vaccine, and not questioning the science behind it. Here in the United States, we have a glut of vaccine. We have more vaccine than we can throw out the window at people. And we sit around all day waiting for people to show up and get vaccinated.
Really, really sad. Our guest has been Dr. Faisal Khan from the St. Louis Department of Health. Thank you so much for being here. Let's go to Aisha Khan and get her final thoughts for today.
Well, my final thoughts are in this super polarized moment that it's really on all of us to demonstrate the civility and respect that we would want ourselves to be treated. And I remind myself of this before I tweet, before I talk to someone who disagrees with me, before I respond. I remind myself that treat them the way that you would want to be treated. And if you disagree with someone's politics, opinions, data, science, whatever you want to disagree with, there's a way to do that while maintaining your own integrity and recognizing the humanity and dignity of others.
Beautifully put. You were even willing to say that you don't care if people call it the Trump vaccine, just take the darn vaccine. And I think that's great. That's great advice. Thank you, everybody, for watching. We're so grateful to you. Everyone, tag a friend right now or hit share on any of the channels you're on. That way people can watch this conversation later. These links will have the show. They'll start right after I hit the end button right here. Thank you very much, everyone, for joining us. Sumitra says, thank you. So much truth spoken today, says Neil. Appreciate the candor and the fact that our guests were so direct. We need to spread the good word. And Apollo says, awesome show. Thank you. And Aparna says that righteous indignation from Dr. Khan should be a wake-up call, reminder that normalcy isn't within grasp, given the political theater and disinformation. We'll leave it there. Thank you very much, everybody. We'll see you again on another episode of our global COVID show. Thanks very much.